Let's pick your favorite subject and show off. Which one you want?
My favorite subject.
Yeah, so Anthony think you smart.
You man.
He don't laugh. What you want?
So what?
Let's do airway
You gonna think
respiration.
he's smart. You gonna think Ken is smart. You say airway?
Yeah.
Let that O2 band in.
Where my $100 at?
Hmm?
Where my $100?
Why?
Because I was right.
Albuterol is administered through which of the following forms?
Oh shit.
Let me see.
That's gonna be C. B.
A says tablet or capsule. B says inhaler nebulizer. C, transcutaneous. D, solution. You say what?
B.
B.
Nebulizer.
Which breathing pattern is commonly seen in patients with DKA, which is diabetic ketoacidosis? A, bradypnea. B, normal breathing with periods of apnea. C, deep rapid breathing. Or D, eupnea, which is normal breathing pattern. Patients with diabetic ketoacidosis.
Diabetic ketoacidosis.
DKA, yeah.
That'd be either C or B, right?
COB, pick one, which one you roll on.
The breathing periods of apnea, deep breathing, with deeper rapid breathing, deep rapid breathing pattern. Choices. Damn.
BG, what you rolling with? C.
See?
We shall
C.
see.
I think it's C.
I think it's A.
Of the following, which
Okay.
is the most superior? Of the following, which is the most superior? Is the nasal pharynx?
Let me know if it's A.
Is it the oral pharynx? Is it the larynx? Or is it the trachea, which is most superior? Is it A, nasal pharynx? B, oral pharynx? C, larynx? Or D, trachea?
Spears me up, right?
Yeah.
It's like a trick question.
Not at all. It's a really easy question. Which one is the most up top?
Oh shit. Also top. Wait, trick is down. Oral pharynx is oral. Nasal pharynx. Can't remember what the fuck the larynx at.
You know it in your eyes, right?
no, it's the nasal. It's the nasal.
Right.
Yeah.
We shall see. Of the following, which is most likely going to cause a disruption in the acid-base balance in the body?
Not, it's most likely not going to cause a disruption.
Yeah, no, that's
Of the following,
Yeah.
which is most likely not going to cause a disruption in the acid-base balance in the body?
Bang bang, girl. Diverticulitis.
B.
When assessing a 55-year-old female patient who called 911 after feeling short of breath, you see her fingers appear bubbles at the end, and her nails are more rounded than flat. This
What's
chronic
bubbles?
sign effect, real fat at the end. This chronic sign of pulmonary disease is called A, terry nails, B, Beagle's lines, C, spoon nails, or D, clubbing.
I ain't never heard of it, but I know it ain't club. It's probably spoon deal.
That's what I'm thinking too. Yeah.
What
What the fuck is a terry nail? Right.
Terry.
And we
Who's
shall
Terry?
see. Snoring respirations in an unresponsive patient are most likely the result of: is it A, tracheal cartilage failure, B, edema surrounding the airway, C, upper airway obstruction by the tongue, or D, foreign body airway obstruction? Snoring respirations in an unresponsive patient are most likely the result of:
It's either B or D.
you say B or D?
What I'm thinking. Because if it's snoring restoration,
Yeah, pick one.
See what I do there.
edema, or just foreign body airway obstruction. Foreign body airway obstruction is more like
That's a choking victim.
somebody choking. Okay. Upper airway been stretching my tongue. So I'm going to the tongue. You might snort the tongue though, right? So it could be either B or C then.
It'd be gangster, pick one and roll with it.
Damn, Lord. Edema again. Wait, edema is
Fluid or swelling.
fluid can cause like a. That's almost. I know I'm wrong for this, but I'm gonna pick C.
C. We shall see. Of the choices below, what are some of the factors some of the risk factors, for emphysema? Select 2. Of the choices below, what are some of the risk factors for emphysema?
Emphysema? Exposure to
COPD.
Is exposure to inhalants, smoking. That's hard to alcohol
It
use.
say select 2. Which one are you rolling with?
A and B.
He says A, exposure to inhalants, and B, smoking. C says heart attacks, D says alcohol. You chose A and B. Number 8. When suctioning your adult patient airway, you must not suction no longer than 15 seconds due to A says pushing obstructions further down. B, esophageal disturbance. C, hypoxemia. D, aspiration. When suctioning your adult's airway, you must not suction no longer than 15 seconds due to.
Yo, we're gonna give you a 60%.
Facts.
You cheated shit.
Are you going with A, B, C, or D?
So you suctioning, don't push airway. You must not suction for longer than 50 seconds to pass pushing or pushing further down the trachea. Hypoxia, aspiration. If you want to suction for too long, but you don't want. So it's either A or C.
Is either A or what?
A or C.
So which one you rolling with?
Damn.
5, 4, 3, 2.
See this though.
You shall see. All of the following are contraindications for the use of a combi tube, except
Basically, that's a hydro or acid.
A says patient ingested acid. B, patient is 14. C,
Copy that one. You guys are free to gas it. Bring it in. Make it
patient
big hard
has
work.
severe facial trauma. D, patient has a strong gag reflex. We definitely get soda right.
Yeah, what is that in South Sea?
Damn. It might be the hydrofluoric acid thing. All the following are contraindications for
You should have hit me up if he changed the schedule. I was
Something
telling
you
you.
accept for a patient is 14 years old. What could that mean?
All the following are
I'm saying
contraindications for the use of
except-
combi tube. Pick one. Roll with it.
Patient has a severe facial trauma, patient has strong gag reflex.
We shall see. You have been called to the scene of a suspected overdose. Your partner places your patient in the recovery position. How is this patient positioned?
In a recovery position?
Exactly. Is it on their back with their knees elevated? On their stomach with their head lower than their heart? On their side with their head lower than their heart? On their side supported by their arms and knees? The recovery position.
I know what the position is.
You in there?
I'm about to. 3 o'clock.
3?
Yeah.
What time is it? No,
2:15.
2:15. We good.
No, it's a part of the shock position. So it may be on the back with the knees elevated.
What do you think you got?
Shit. Let me have faith. 70?
Change it. Change it.
62. 80. Look at that.
Oh, it was right.
Let's go with the ones.
It was clubbing, man. Listen to Anthony, man.
Yeah, you listen to something. So it's
I'm gonna
clubbing.
say clubbing.
A lot of people with COPD and their
Yeah.
fingertips are like fat,
Yeah.
and they call that clubbing.
Clubbing, okay.
The recovery position.
On the
they're
side,
on
so
their
with
side.
their arms and knees.
Their
I thought
arms
about
and
that.
knees,
I
yeah.
was like, is it on his side or it's on the back with their knees elevated?
It's also called lateral recumbent.
Yeah, because that position is Trendelenburg, right?
Which one?
On the back with the knees elevated? Is called it's all part of the shock.
On their back with their legs elevated. That is the shock position. Good.
Right, shock position.
That'd be Trendelenburg.
Right.
Supine with their legs elevated.
Supine, right.
6 to 12.
Get that. What? Another 80.
And
I gotta study OGYN. That's hard.
all right. So albuterol, which form? You're absolutely correct. Inhaler / nebulizer. Good. Which breathing pattern is commonly seen in patients with DKA?
Deep rapid breathing.
Good. That is called
Yeah.
Kussmaul.
Yeah, Kussmaul, yeah. Mhm.
They're trying to blow off all that acid because they're in diabetic ketoacidosis.
Nasopharynx is higher. Yeah,
Good. Of the following, which is the most superior? The nasal. And this is the right order. You got nasal pharynx, oral pharynx, larynx,
and then you got
trachea.
the very lower larynx is in the middle. Trachea is really far down.
Of the following, which is
It's the
most
lightest.
likely not going to disrupt the acid-base balance? This is a good question.
Really
pH
good. That is
balance
hard. I
is
see that.
7.35 to 7.45.
Mhm.
You got acidotic, and then you got alkalosis.
Right.
Somebody who's hyperventilating, breathing too fast. Did you just have a question like that?
I think so. Yeah. We had something
Somebody-
similar to it.
But so the answer, so somebody's hyperventilating, they're breathing
Yeah.
too fast.
Mhm.
Are they acidotic or alkalosis?
Say acidotic, right?
They're alkalosis.
Alkalosis,
they're
right? Alkalosis.
Blowing
Yeah,
off
blowing-
all the
blowing
it's
off,
all about
yeah,
CO2. If you're blowing
Yeah.
off too much CO2, you're alkalosis.
Alkalosis.
If you retain it,
Acidosis.
you're acidotic.
Acidotic.
So B, somebody who's hypoxia,
Right.
somebody who's shallow breathing,
Mhm.
are they alkalosis or acidosis?
They will be alkalosis, right? Acidosis.
Acidosis, they're
Acidosis,
barely
You
breathing.
very breathe acidosis.
And let's go to the last one, hypoventilation. Somebody with low ventilation, somebody who's low ventilating.
Hypo low, hyper high.
Good. If they're low ventilating, are they acidotic or alkalosis?
They low, then they alkalosis then. Acidosis.
Acidosis.
Acidosis. I keep fucking
If
that.
it's low ventilation, if I
And-
can't get air in and out,
Yeah,
or if
right.
I'm shallow breathing,
Yeah.
I'm retaining
Retain-
CO2.
Right. CO2.
I'm acidotic.
Acidotic.
If I'm blowing it all off like I'm hyperventilating,
then you alkalosis.
then I'm alkalosis.
Right. Okay. Acidosis.
It's all about the
Alkalosis
CO.
out.
Hyperventilation,
Right.
you alkalosis. You blow all the acid off.
Mhm.
You keep too much. But nothing about diverticulitis.
Right.
It's about acid and base. Snoring respirations in an unresponsive patient
Yeah. From the
are
tongue.
always the result of the tongue. You
Tongue,
simply
yeah.
open the
I think
airway.
about that for a second.
And once you open it, you insert an
I lost
adjunct
an edema too, so.
to keep the tongue off the airway. 2 risk factors for emphysema. Number 1, smoking. And the other one could be accidental. You was exposed to some inhalants. And one of the reasons why we only suction 5 for infants,
get that.
10 for
I
peds,
was sure
15 for adults,
Yeah.
because hypoxia or hypoxemia, you're taking too much oxygen out.
Right.
All of the following are contraindications for the use of combi tube except, and this is the one I gave you. Alright, so what are contraindications for combi tube? Anybody who ingests this type of acid can't get a combi tube, because
Right.
when you put the tube in, you're at risk of having them vomit and throw up.
Mhm.
14 years old, that's just peas. We don't put combi tubes in. We don't even use combi tubes, but just for
Yeah.
knowledge,
That's what I was saying. A combi too.
people who are 14 and younger do
Yeah.
not get combi tubes. And anybody with a gag reflex, you can't stick a tube down their throat.
They're gonna,
They're gagging. They're going to vomit, and especially if there's acid involved.
which mean their airways
They tear
down
their airway
anyway, they gagging. Or they pushing it, whatever is blocking this out.
That was good. That's in like 3 videos. Can I
Get that there, man. We gotta do some more of these.
Yeah, we'll do some more. What time? We